All right, welcome everyone. I am seeing 1203 on my screen. If you are just joining us, I have dropped the sign-in sheet in the chat. Please go ahead and sign in. Introduce yourselves in the chat as well, name, organization, and where you are calling in from. This webinar will be recorded today, so if you have colleagues that were not able to join us, a recording will be available shortly. So welcome. We are here for the from the Data to Practice series webinar. Before we dive into our webinar today, just wanted to go over a few logistics through Zoom. So this is Zoom webinar, so participants will be muted during the webinar and you will not have your cameras on. There's a symbol on the right of the audio where you can manage your volume if you can't hear us. If you're having audio trouble, please shoot myself or Thomas a message and we can help you get sorted out. The chat button will allow you to send messages, and there's a few different options. You can send just to the panelists or you can send to everyone. So just double check to make sure which one is selected when you type in the chat. There is the raise hand feature that will flag to us that you have a question. So we can address your question that way, but the best way would be the Q&A feature that you see on the bottom of your screen to submit your questions. If it is not answered right away, we will be watching those questions come in on our end. So if it's not addressed during the training, we will get to those at the end. And if you, for some reason, need to leave, you see the leave button here on the bottom of your screen. Yep. Awesome. So again, welcome to the From Data to Practice series. Today we will be talking about using YRBS data to inform adolescent sexual health programs. The webinar series offers an opportunity to really look at the Alaska YRBS results and see how the data is used to inform programs, policies, and priorities across Alaska. Each webinar focuses on a certain topic and then looks at programs and resources available across the state, and then also highlights services and outreach efforts that are in our local communities. So without further ado, I will introduce our two presenters today. So we have Andrea, I'm going to pronounce this wrong, so please correct me if I do.
Fenaughty.
Oh, okay, there we go. So Andrea currently serves dual roles as the chronic disease epidemiologist and deputy section chief for the section of chronic disease prevention and health promotion. Andrea has a PhD in social psychology and spent a decade at the University Alaska Anchorage conducting research on HIV risk behavior before becoming an epidemiologist with the state in 2002. Andrea sees surveillance and evaluation as powerful tools that can be used to improve public health outcomes, public health programs, and ultimately the quality of life for Alaskans. And then we also have Lindsay Hammer with us today. Lindsay is a public health specialist too with the Child and Adolescent Health Unit for the state of Alaska, Division of Public Health, Women's, Children's, Family Health Section. She's the current project director for the Personal Responsibility Education Program grant that funds the 4th R in Healthy Relationships Plus curriculums. Lindsay is a licensed clinical social worker with experience in facilitating trainings on prevention, intervention, and post-prevention strategies for addressing suicide prevention, substance use prevention, and behavioral health promotion in rural communities and with various populations. In addition, Lindsay has clinical experience working with individuals with serious mental illnesses, substance use disorders, and individual and family therapy. So without further ado, I will turn it over to Andrea and Lindsay.
All right, thank you, Anna. Well, good afternoon, everybody. As just introduced, I'm Andrea Fenaughty. I'm the Deputy Section Chief for Chronic Disease Prevention and Health Promotion, which is the unit within the Division of Public Health that houses the Youth Risk Behavior Survey, or YRBS. We are currently recruiting for a new YRBS coordinator, which gives me the opportunity to step in and talk today a bit about the YRBS data that might be of use to those of you working to improve adolescent sexual health. I want to thank the Alaska Children's Trust for hosting this webinar series and thank all of you for taking time out of your busy schedules to join us today. And joining me today also is Lindsay Hammer, as you heard, the 4th-hour project director from the section of Women's, Children's, and Family Health. And she will share how YRBS data have helped her important work and how it might help any of you. So here's a brief overview of what this webinar will cover. Lindsay and I will be doing a little bit of a tag team throughout the presentation. I assume most of you are somewhat familiar with the YRBS, but I'll take the opportunity to cover the highlights of it, including specific YRBS questions that are related to adolescent sexual health. Then Lindsay will set the context for why we should care about this topic, and more specifically introduce the 4th-hour program that she manages here in Alaska. Then back to me to touch on how you can access YRBS data and what kinds of questions you can ask and answer with the YRBS data. Then Lindsay and I will take alternating turns discussing select YRBS findings related to sexual health and possible programmatic implications of those findings. And we should have time at the end to answer any questions you have. The YRBS is conducted within randomly sampled high schools across the state. It is carried out by health department staff working with school staff to administer the survey, and this is also in partnership with the Department of Education here in Alaska. We do a YRBS in traditional high schools, and we have a separate sample of what the Department of Education and Early Development calls alternative schools, or schools that serve students who benefit from non-traditional school settings and programs. Alaska did its first YRBS in 1995 and has been successful in attaining weighted data every odd year since 2007. The YRBS survey has over 100 questions covering topics that are associated with the leading causes of significant health outcomes for youth, which include safety, violence, suicide and mental health, alcohol and other drug use, weight status, physical activity, nutrition, tobacco use, connectedness, and important today, sexual health. Just a couple points on methods. In Alaska, we only do a high school YRBS, so that's 9th through 12th grade students. The schools and classrooms are sampled and then weighted statistically in a way that allows us to end up with data that are representative of high school students statewide. So what that means is we can talk about the percent of high school students in Alaska who use e-cigarettes, for example, rather than just the percentage students who responded to the survey who use e-cigarettes. Students complete the survey within a single class period. Whoops, excuse me. And as many of you know, the YRBS is usually conducted in the spring of odd years. Due to all the school closures and remote learning that happened in the spring of this year, Alaska, like many other states, moved administration to the fall. So we are currently working with selected schools to encourage their participation. I just have to say, we also realize schools are still really operating under extremely difficult and ever-shifting circumstances. Data collection will be challenging, to say the least. And finally, I can't emphasize enough, the survey is anonymous, voluntary, and we only survey students who have parental consent. So we can't know all the ways our partners use the YRBS data, but here are some of the most common uses we see. Programs, including those within the section of Women's, Children's, and Family Health, use YRBS data to track important health outcomes in the state. Programs in and outside of state government use the data to improve their programs. For example, our tobacco prevention and control program looks at e-cigarette use among different groups of students to figure out how to better reach students at highest risk. Those conducting community health assessments use the data to help guide the health priorities they will take on. One example of this is Healthy Adolescents 2030. And a number of partners include YRBS data in their grant proposals so that potential funders understand the scope of a given problem and also our ability to monitor it. I'm not going to play this for you now, but I wanted to call your attention to this video we created. It shows our partners using their own words to talk about how they use YRBS data. Due to the cyber attack, you may or may not have heard of the department's website, you can't just go out to the YRBS webpage as normal and find it there. So I believe Anna's going to be able to drop the link in the chat box so you can grab it and watch it later. Please consider playing it at meetings, events, or in waiting rooms. So help us spread the word on how YRBS results are used in Alaska's communities and the importance of participation. So what are the questions of interest for this topic on the YRBS? These are the YRBS measures found under the topic of sexual health in the YRBS data dashboards that I'll be reviewing in a few moments. I grouped them into three somewhat overlapping categories of sexual activity, sexual risk, and protected sex. Note that the measures with asterisks are examined just among those who say they've been sexually active in the last 3 months. So here's more detail about those measures. Under sexual activity, we ask if the student has ever had sexual intercourse and if they had sexual intercourse in the past 3 months. That's our definition of currently sexually active. To look at sexual risk, we can look at whether the student has had sexual intercourse with 4 or more partners in their lifetime, whether they drank alcohol or used other substances prior to their most recent sexual intercourse, and if they had first sexual intercourse before age 13. For protected sex, we look at use of condoms, birth control pills, IUD, and either the shot, patch, or ring during last sexual intercourse. And now I'm going to turn things over to Lindsay.
All right, well, good afternoon, everyone. I'm going to start with kind of going over a broad idea of what the specific adolescent health program has used these sexual health behaviors for and other YRBS data. So in general, we, of course, use it for our program planning and development, looking at what different trainings we offer, curriculum we provide, and then just general, like, where are there gaps in what we have going on for our program that we could be offering our partners and the community at large. For me specifically, I manage a health curriculum, so a lot of it focuses on when do I need to look at these measures and consider it when I'm updating the curriculum content with the proprietor. So is it up to date? Is it still aligning with what the trends we're seeing with the youth are? Some of our partners who also work with adolescents use it for their school health profiles here. We use it for our needs assessments, both on community levels and when working with specific schools, policy development. And this is a lot of times with looking at working with different work groups on specific school policy development, as well as overall policy development. And then a big one that we kind of have been trying to steer towards more is also providing professional development opportunities for our professional, both providers and teachers across the state of Alaska, to see where could the measures help inform practice for them. So maybe skills that might even be lacking with professionals that we're seeing as a result in the youth's response. And then the main one being grant reporting and funding proposals. So a lot of our measures are used to help support seeking further funding, as well as our general grant reporting. So I use it, quarterly. I have to report for my grant, but then also on a yearly and several year basis, do we have to do reporting? And so we use this data to help support our need for further funding. Next slide. So to kind of go further into how we've used it for curriculum planning, specifically sexual health curriculum planning, we really are trying to focus on doing a universal approach when it comes to it. From K through 12 education, most students are taught to read and write aspects like the general education, but we also want to offer the opportunity to learn these healthy relationship skills and other social emotional learning. And so this has been a trend that we've seen coming forward the last few years, and it's continuing in our schools today, especially with this past year in the pandemic, that we want to offer both the opportunity to have social emotional learning and healthy relationship skills taught to all youth and not just targeting the high risk youth. Because in general, everyone's going to need to know these healthy relationship skills, and we don't want to just miss a needed population by having it. So that's one of our big focuses, is taking some of these and looking at across the board, where are we seeing the highest needs for the measures, and then how can we incorporate those needs into the curriculum we're selecting. So are we looking at needing to increase for different topic areas of sexual use? Are we needing to look at like this healthy relationship skills that have to do with interpersonal violence, relationship and violence? So really kind of taking some consideration on how we're selecting the curriculum we're offering to the state and across the state, I should say. Next slide. So the curriculum we currently offer is the 4th R, and some of you may be familiar with it, whether it's because we've interacted or you've taught it, but in general, the 4th R was developed by a group of teachers, psychologists, social workers from the University of Western Ontario in the early 2000s. It's a school-based curriculum that really focuses on the idea that relationship skills are as important to learn as the 3 other R's, being reading, writing, and arithmetics, and the last R being relationships. The program focuses on building these healthy relationship skills through interactive teaching methods like role play, educational games, and general aspects of getting the students up and going and interacting, as opposed to just sitting and looking at the whiteboard and listening to the teacher narrate. It's the belief that the positive, healthy relationship skills can be taught the same way, but through that skill building aspect of interaction with the youth. One of the biggest parts of this is it has the idea that we want to make sure it's comprehensive, and it includes not just the students and the teachers, but the parents and the community overall, to help reduce violence and the risky behaviors among youth at risk, as well as youth overall. They always kind of have the idea that we want to make sure the teachers have the opportunity to practice these skills that are taught, and the youth are also offered the opportunity to practice. So that's one of the main things I do in providing the 4th R, is I help train the teachers in implementing the 4th R curriculum and practicing through those skills with them during the trainings. So next slide. We do also offer the Healthy Relationships Plus program, which was mentioned in the introduction. So I wanted to just give you guys an idea of the difference between the 2 programs. So the 4th R is one that is based in the school districts for health curriculum. The Healthy Relationships Plus program is more of an after school or community-based one, and that one's appropriate through, past the age of 18, the school grade level, and actually has been used in a lot of the domestic violence shelters and other things like that to teach different healthy relationship skills. One of the major things in reference to the sexual health measures that we're talking about for YRBS is the Healthy Relationships Plus program doesn't have any growth in sexuality units. And that's the thing that we are really focused on for the 4th R, in making sure we're providing that to the youth across Alaska. One of the things I always like to cover is that all the lessons do talk about sexual health and safety, as well as mental health, prevention of STIs and STDs, and as well as unintended pregnancy prevention, and mental health, specifically suicide prevention. All right. So thinking some about what does 4th R here in Alaska look like, I wanted to give an idea that we have been implementing it since 2011 to 2012 timeframe was when they started rolling the 4th R out. And since then, they did conduct an evaluation between 2011 and 2013 to see kind of what the results were. And what they found was it's improved awareness for abusive behavior in relationships. It's improved positive social support among youth, and it being most effective for youth who have experienced more adverse childhood experiences. It reduced the acceptance of physical aggression within relationships, and reduced adherence to rape myths. And as part of this evaluation, YRBS data was used to help inform the questions and the development of the evaluation plan with the individuals we contracted with. Since it started being implemented, we roughly have 113 schools who've received the 4th R health curriculum in the past few years and have continued to use it, and approximately have trained at least 650 school staff since 2012. There have been a few more who've been trained in the last few months, and we just haven't input that data as I was out this spring for a while, and so I haven't quite caught up on all of my work. Further, for the next slide, sorry. I wanted to talk some about how the 4th R has been implemented in the last year during the COVID-19 pandemic. So we still have had 113 schools who reported still implementing the 4th R in some format, and around 1,700 students who've received some portion of the 4th R curriculum, either virtually or in person. And I say some portion due to the fact that sometimes they were in person and then they had to move to being virtual, and they had to prioritize different topic areas. And that was one of the largest challenges in the last year, was that health education kind of went to the wayside as opposed to the math and English focus for some of the virtual implementation during the schools. And I will hand it back to Andrea for the next step.
Thank you, Lindsay. So the best way for you to access the Alaska YRBS data is to use the data dashboards that data manager Taslina Mannix created last year. They are easy to use and provide quick access to the majority of what data users request from us. I'll go through a few screenshots that show you how to access them, and also we'll put some links to both the dashboards and a YouTube webinar tutorial in the chat. Unfortunately, again, with the cyber attack, it's a little more challenging to find this information if you just were to go out. So clicking on the link in the chat, once it's placed in there, will take you to a page from which you can go to a number of the data dashboards. This is the overall one that I'm showing on the screen right here. I'm not going to go over what every single of these little blue tabs at the top do. Feel free to look at the YouTube tutorial or just to kind of peruse around. But what you would do here to get to the data is to click on the data dashboard tab, and you will land here where you get to select first the health topic you're interested in by pulling down this. For example, nutrition and body weight, and then you'll see a specific set of indicators available for that topic. In this case, with nutrition and body weight, you have options of looking at sugary drinks, fruit and vegetable consumption, and weight status defined some different ways. So click on the one you're interested in. Say, I want to look at rates of obesity. And you'll be taken to that specific dashboard for that measure. You'll see prevalence estimates and confidence intervals for the most recent year of data here, 2019, overall by age group, by sex, by grade level, and by race. And you can change the year by selecting a different year there under select year. Farther down on the page, you'll see trends over time, over the time period that question's been asked. So that varies from question to question. And you'll see that overall by sex and also by race. And note that you can see if the linear trend is significant, both for the entire long-term trend, as well as just since the previous administration. So here it would be since 2017. There are a number of additional features, such as the ability to download data, but in the interest of time, I'll skip over that right now. Please, though, reach out to Taz Mannix at yrbs@alaska.gov if you have any questions. So before I launch into a review of what some of the YRBS sexual health data show, I wanted to frame the presentation in terms of questions that the data can be used to answer, and specifically what programmatic questions might look like, just to get you thinking of the different ways you can use YRBS data. First, the overall percentages in the dashboards are prevalence estimates. That is, they tell us how common or prevalent a specific behavior is. There are many uses for this kind of information, but one is that it can shine a light on areas where intervention is needed. If we see some particular risk behavior or condition is very common, such as overweight, for example, that might tell us that would be worthwhile investigating and addressing it. Trends in prevalence estimates tell us if a behavior is increasing or decreasing. So similar to the previous example, they can alert us to areas of growing concerns, such as e-cigarette use. But they can also be used to get a sense of whether a program or policy is having its intended effect, or if we need to try a different approach. I'll make the caveat here that the YRBS is a point-in-time survey. We're not surveying the same kids over time. So we can't really use YRBS data by themselves to prove cause and effect. We can, however, look at trends and see if they're consistent with what we'd expect to happen as a result of policies or programs that we put in place over time. Finally, comparing subgroups can be very useful as we design programs, knowing who might be at most need of a program, or finding those groups that are those positive deviants. Maybe there's something we can learn about why one subgroup of teens seems to be at less risk than others. So with those questions outlined, I'm going to share some of the data we see with the sexual health YRBS measures I showed earlier. Then invite Lindsay to offer any actual or potential uses of the data for her program or for partners she works with. The percentage of high school students who report ever or in the last 3 months having had sexual intercourse declined between 2007 and 2019. And that's a significant decline, just noted with the little yellow asterisk. Now, you might look at this and say those trends look flat for most of that time. I'd agree. It looks to be very stable since about 2011. The long-term trend that is provided on the data dashboard is called a linear trend. So that is, it tests whether the best fitting straight line through the points differs enough from horizontal or flat to be considered statistically significant. Because YRBS questions have been asked over different periods of time, it would be pretty complicated to make available on the dashboard the trend significance of every possible duration of questions. So here you see a dashed yellow line. That's the straight line that best fits the trend in ever having had sexual intercourse. And because that line differs significantly from flat, we say there's a linear trend.
All right. So Andrea did a great job kind of giving an overview in that slide where she had this chart of like the program, the questions, and what can be answered. And that is exactly along the lines of how we use the YRBS data when we're looking at, assessing our programs and evaluating them. So when we're considering the past 2 slides where she showed that measure, we want to look at the data, and she's correct. Like, we can celebrate, that sexual behavior, the decline, but she's also right that in 2011, it starts to kind of, be fairly steady. So we wanted to look at this as a strategy and like, what kind of interactions are we doing with youth when it comes to sex education? So is the curriculum we've been using during that time period still relevant to youth today? Or is it somewhere where we want to start having more evaluation on updating the content or changing to a whole different health curriculum altogether? While positive trends can really support the current efforts, we want to really look at making sure we're staying up to date with what's going on with youth in today's world. And so that's where we really try to incorporate having youth invoice in deciding what we're providing through our program. And with the YRBS, that is one form that we can really use to have for youth, is seeing what they're saying. That's one way we can have across the board, more than just focusing on a lot of times our youth advisory committee that we work with through our program. Another thing I would also want to say is when we're talking about like these sexual health measures, to really acknowledge the fact that like sexuality and sexual behavior is a completely normal behavior. And we're not saying that sexual activity is a risky behavior, but acknowledging that it's what we're wanting to look at is where is it we need to focus to ensure we're encouraging and building youth to know that their own autonomy for their sexual relationships, and how we can provide them the tools to ensure that they can have safe and healthy sexual relationships and sexual behaviors when they're making those decisions. Next slide.
All right, so here's some other data. Here we see a sex difference in the age at which students begin to be sexually active, with boys being about twice as likely as girls to have had sexual intercourse by age 13. I'm going to turn it over again to Lindsay.
So when we're looking at interpreting data, especially when it comes to being specific for genders, one of the things we want to consider is, are we approaching sexual health through a gender equality lens? Are we being inclusive of all identities that are also occurring? So this is self-reported data. So that's always something we want to consider, that has impact on how we want to interpret it. But we also want to consider the fact that when it comes to males and females, in general, we do focus our sexual health education differently when we're talking to when we separate those genders. We see that when it comes to providers talking with youth, as well as, I don't know if sometimes they still separate the males and females when actually providing sex education. In one study, they've noticed that primary care providers are 3 times more likely to take sexual health histories from the females than the male patients, and are twice as likely to counsel female patients on the use of condom use for unintended pregnancy. And so this is where we want to start to kind of look at, how are we going to be discussing sexual health relationships for both genders, and make sure that it's inclusive, that we're focusing on the same things for both the genders and not singling out individuals, because as we can tell for this self-report, the boys are more likely to start having sex at age 13 than females. Is that the full case? We don't know, since it is self-reported data, but it's something we want to make sure we're considering when we're doing our program planning and working with both teachers and providers in educating them on how to talk about sexual health. Next.
All right. Having multiple partners in one's lifetime, this shows, is increasing with age, particularly at age 18. Now, any measure that is an ever measure, that is one that assesses behavior over a student's entire lifetime, would naturally be expected to increase as students age, right? They have been alive longer and have had more opportunity for any behavior to have occurred, because it's a cumulative measure. Still, you can see here that there's quite a jump in having multiple partners between age 17 and 18. Again, also may not be a surprise given that 18 is the age of majority. All right, Lindsay.
So I know this image can be really hard to view. And so I did ask that Anna if she can send out this logic model for people to view after the webinar, or I'm happy to also share it to anyone who wants to contact me. But this is just an example of how we use, like the previous measure, when we're doing an overall planning about talking about youth sexual risk behaviors. So this is a logic model we developed for our program in the past, and you can see where we find and utilize YRBS data throughout to help kind of look at our intervention activities and to see where it would change in the overall to get to our overall goals. Being that one of our big focuses is we want to look at how does the data relate to the protective factors that we are trying to focus on increasing versus the risk factors that we are trying to decrease. Specifically for us, what we have found with protective factors and risk factors is the most 3 important protective factors we can have are things like 3 supportive adults. And that has a lot to do with like looking at, how are we talking to the youth about sexual education? How are we talking to the youth about contraceptives? And how are we talking to them about their healthy relationships? So it's just really an overview of how we have used the YRBS data across the board, not just specifically for that measure, to inform our program development.
All right, and this graph shows the percentage of sexually active high school students who used alcohol or drugs before their last sexual intercourse has neither increased nor decreased significantly over the past 12 years. Note that it's not a completely flat line, but there's a bit of bouncing up and down, and overall it's not a significant trend, either going up or down.
So for this one, I really kind of take it from two ends. We have our funding use of a measure similar to this, and the specific measure actually, and then our program use. So for the funding use, measures similar to this regarding sexual activity and substance use, we specifically use to support our grant proposals that when we're seeking funding on how it relates both to unintended teen pregnancy prevention, but also the high risk factors that can come with that. So substance use. And that is one thing that is part of the personal responsibility education program grant, or PrEP, that I manage, that they want incorporated as part of the health curriculums we're providing. So things like, condom use is important, but also what is the substance use? And so this would be a measure I would use when reapplying for funding through the Family Youth Services Bureau. And the fourth R does incorporate both substance use prevention into their education curriculum and relate it to the sexual health. So, and then going to like the program use end, we really consider this when, again, looking at the risk and protective factors and what interventions and prevention programs we're offering. In interventions for both male and female adolescents, prevention of substance use and risky sexual behavior should be integrated in what we're providing. For boys, they found that efforts should focus on the reduction of peer delinquency and like peer use, while for females, they found that the improvement of family support should be more emphasized. And so we want to make sure that we're providing both of that in the content that we're providing to youth. Specifically, a large one being that we want to focus on is talking about consent, and that is also included in the fourth R curriculum, and relates to when someone is using substances while also engaging in sexual activity, talking about, is informed consent really possible, and making sure that's clear. And if we can provide that education to the youth, but also incorporate it in how we talk with the providers to talk with youth and family members, then it can help provide a more universal approach.
All right, and then about half of sexually active students used a condom at their last sexual intercourse. And you can see here how that stacks up against these other pregnancy prevention methods.
So when we're considering kind of contraceptive use, in the measures in the previous slide, a lot of it has to do with our program planning on what is the access and what is the understanding of the different birth controls that youth have to it. So we really want to help provide access for youth and encourage our partners on how they can have. So maybe that is through school health centers and our youth-friendly clinics. But we really kind of consider these YRBS measures, as well as one of the measures that we didn't have reference is the dual use. So that means using a condom and another reliable form of birth control when we were talking about unintended pregnancy as well as STDs. And so I look at this currently for the projects I'm working on and similar methods to help support the development of some of our professional development series that we're doing for providers. So talking about how on average, 36 seconds is what's spent on talking with a youth about contraceptives and unintended pregnancy and STIs and HIV prevention, as opposed to really incorporating that in every single visit when you're talking with youth, and how it needs to be a more open and longer conversation for both males and females. Similarly, with parents, we really want to look at what is their comfortability talking about it. So making sure we can use data like that to help encourage parents to become more comfortable talking about sex and sexual health and healthy relationships. And so one of the things I really like to talk about is our Teen Speak offering. And that's one of the trainings that focuses on motivational interviewing that we provide to teachers, parents, community members, providers on how to have those difficult conversations with youth and encourage them towards those positive, healthy behaviors and steering them away from those risky sexual behaviors.
All right, so just in conclusion, I encourage you to use the YRBS data, try out the dashboards. If it doesn't seem intuitive to you, watch the YouTube we posted in the chat or reach out to Taz or myself and we'll certainly help you. If you have used YRBS data, we would love to hear how. We get asked about this all the time, and it's really useful to know the different ways people are using it. If you haven't used YRBS data in the past, I encourage you to consider the ways the data might be useful to the program or to your work. We've highlighted just a few applications of data in this presentation, and I know there are many others. And if you have questions about anything about the YRBS, specific questions on the survey, or how the dashboards operate, please don't hesitate to shoot Taz an email. And I guess Lindsay can speak for herself, but if you have questions about the 4th hour, you can direct those to her. I don't know, Lindsay, if you have anything else you want to conclude with before we throw it open for questions?
Yeah, just reiterating, if you have any questions on the 4th hour, we do have several trainings coming up in October and beginning in November for implementing the 4th hour, but I'm also happy to talk about any of our trainings and resources we offer through the Adolescent Health Program. I would normally provide our website, but it is still currently down from that May hacking. And so hopefully in the near future, we'll be back up. But until then, we are available, and I'm open to email or any kind of Zoom conversations people would need if they have an interest. And thank you for coming.
Awesome. So before we actually head into questions, I just want to thank you, Andrea and Lindsay, for your wealth of knowledge, sharing your knowledge and resources around adolescent sexual health. It is a tough topic, so we appreciate you being here with us. So before we dive into questions, I just want to take a moment and drop in the chat also our training evaluation. So your feedback is really important to us and helps us shape and guide how the YRBS data to practice series goes, and we just want to make them as beneficial as we can for you all. So I will go ahead and drop that in the chat, and we will open it up for questions. So any questions you may have, go ahead and drop them in the Q&A box here you see on the bottom, and we will get those addressed. Lindsay and Andrea, oh, you might have seen the question in the chat. What schools have been selected to participate, and how do we find out how to support them with data collection?
That's a good question. It's a tricky question because we usually don't broadcast the schools that are participating because we're their partners and we're trying to encourage them. And so I would say if folks are interested in finding out how to support the YRBS in their community and finding out everything they could do, the best way to do that is to reach out to the YRBS program, which, as I said, right now is Taz Mannix is the sole person kind of holding down the fort as we're recruiting for a coordinator. So that YRBS@alaska.gov email, reach out to her, say, hey, I am part of this program, or I work with this community, and we really want to support the YRBS. We have folks work with the program rather than just reaching out directly to school staff or district staff, just to make sure it's coordinated and we're being supportive of the district and the school staff and the way that works for them. And we've had long-standing relationships with those schools and just try to really maintain that and still be as encouraging as we can.
Thanks, Andrea. Chicken Q&A. I don't see any other questions coming in, but we will be here for a little bit longer. And then Andrea and Lindsay, I'm not sure if you want to show your contact information again so that people can jot that down if they want to.
This is Thomas. Oops, my screen's there. This is Thomas. And one of the questions we frequently get from a lot of providers is around, and this would be towards you, Lindsay, around sexual health, is in regards to what type of parental consent is needed to either engage kids, especially in the out of school time setting, around sexual health curriculum, or how do they find out what is already being taught in schools so they can reinforce it or expand to it? Do you have any kind of guidance to help program providers kind of navigate that sticky area of teaching and talking about sex, especially once it falls in that out of school time space?
Yeah, so a lot of it has to do with checking with the school district and their policies when it comes to specifically for sexual health and health education. There, per state, there are specific requirements when it comes to sexual health. You know, then there's other topic areas where they're not allowed to talk about specific aspects. And so that can change from state to state. So I would say one thing to always recommend is reaching out to the school district and asking for the health curriculum coordinator, because they have the best information for your school district. And I do have the list of all the health curriculum coordinators. And so I'm always happy to make an electronic connection between individuals if they have a question on that. And then I think one of the most important things we encourage any school that is implementing the 4th R specifically is to send the parent letters home about what's going on in the engagement with the 4th R topic areas. So if they're talking about, you know, suicide prevention, then we specifically like them to really communicate like that's what's going on within the home, to have it also discussed within the home as well as at school. So kind of encouraging teachers as well to be proactive when they're engaging with parents and sexual health and any health education.
Great. And one other question that I know we frequently get asked to us in the Children's Trust and the after school network space by our providers is, what age is the age of consent for sexual activity? Is it 16? Is it 18? Where does that fall?
I believe here in Alaska it is 16 within a certain amount of years. And we are a state, this is like kind of a random information that I do know it has to do with what they call a lot of times the Romeo and Juliet law, that there is a certain period within an age where if someone was 15 and engaged in a sexual relationship with someone who is older than 18, then that is considered not like a consensual relationship. And so there are certain rules specifically when it comes to age range. So if it's something to be very aware of, and we talk about during consent with youth, is knowing, you know, your guys' age does matter, even if you both are consenting to the relationship. And so it kind of gets sticky and very in depth. But I'm happy, I do have a form that kind of outlines it, and I can send that if you guys would like to reference it. And that comes from my clinical work days.
And I actually have a question. I think this is more of an Andrea focused question. So something that we have also heard, so Alaska is an opt-in state with the YRBS, meaning that parents have to sign off that, yes, my child will participate in the survey. And we know we have challenges with data because of the opt-in option. So what are some things that we can do as after-school providers, as advocates in the field, that can help parents feel more comfortable, maybe gain a little more knowledge about what the YRBS is, and that it's not some big scary thing that the state is making the kids do.
Yeah, no, that's a great question. Thank you for that. And yeah, I think we're always challenged a little bit with dealing with that. And we know it makes it harder to get weighted data. And so I feel like we have, multiple audiences for the message that the YRBS data are important. So it's, the school staff and district staff, in order to provide them any help that might make it easier. Would moving to doing it at time of electronic registration and getting in and having the forms filled out, then would that ease their burden and make it easier for them to do? For youth, we really try to promote the message that, like, this is your voice, like you get to say what you're doing. And by the way, most of these risk behaviors are the minority, right? If you look around at, across these things, substance use or, sexual behavior or whatever it is, most of your peers are on the positive side of what often gets reported as a risk behavior. So if that's important to you to have an accurate reflection of what the state of Alaska looks like from the high school student perspective, participating is a good thing. Obviously, they can't do that if they don't have parental consent. And so the parents are the other, audience, if you will, to say, like, and we have an FAQ for parents and an FAQ for schools, and it goes through some of these points. But, sometimes if folks are not that familiar with surveys, there's sort of this idea that students answering questions is going to make them more likely to engage in that behavior that they're being asked about. And there's been lots of research to show that's absolutely not the case. And just trying to alleviate concerns that parents have. I mean, I'm a parent. I'm concerned about what my child is exposed to. I totally respect that. But there's a lot of questions that we have good answers to. And so we can share those FAQs. Again, website stuff, but we can find ways to get that information out. Again, some for parents and some for schools, depending on what that information is. But yeah, we want to answer any questions we can. And it is ultimately up to the parent. And then beyond that, if the parent says, yes, my child can participate, that student does not have to take the YRBS. It's totally voluntary for them as well.
Great, thanks, Andrea. So taking another look at Q&A, I don't see any other questions in the Q&A. So again, if you can just take a moment and fill out our evaluation link, that would be very much appreciated. And with that, Lindsay and Andrea, thank you so much again. Thank you all for joining us today, and enjoy the rest of your Thursday.